All right, folks, this is a chemical peel agent. This is what estheticians use to literally peel the entire skin off your face. So what we're gonna do on this video is talk about chemical peels, what they are, when to use them, and how to use them. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna talk about a very interesting and very historically relevant topic, and that is chemical peels. Chemical peels have been around for literally forever. I mean, from the point of view of cosmetic procedures, etc. It's actually one of the very first skin resurfacing modalities ever existed. The heavy duty phenol peels, the deep TCA peels, all these different things that you may have heard about were literally the go-to approach for people with deep lines, people with pigmentation, laxity, all these different things that people were trying to address and rejuvenate their skin with before they had lasers, before we had all these other type of energy devices, RF devices, and all that. Chemical peels was the primary way of doing it. And what's fascinating is it works. Chemical peels are an incredibly valuable piece of the entire skin rejuvenation arsenal. Now I'm gonna go through all the different chemical peels and which one might be right for you, but overall, it's not technology. It's nothing fancy and exciting. It's not a shiny, object, but at the end of the day, it works. And there's some nuances that you need to understand about it before you jump and go out and get this, but I'm gonna give you a guideline to all that. It really has been a very, consistent part of my practice. It'll be a very valuable piece to your your overall approach. So here's the thing, just in a nutshell, let's just talk big picture here and we'll kind of start breaking it down. So in a big picture, you've got three categories of chemical peels. You've got the superficial, you've got the medium depth, and then you've got the deep. So in the superficial category, you've got a lot of different types of choices, and a lot of them are actually combination peels that have certain brand names associated with, like the V peel or a Jesner's peel, which is like literally a combo of a variety of different types of acids that are put together to accomplish what you're trying to accomplish, which is peel away, as the name implies, a superficial layer of the skin, the top part of the epidermis. You're going to try to remove that away. What happens is, if you've got issues related to pigmentation, dullness, I've given talks about the importance of exfoliation, which is to remove all that dead stuff off the top of the skin. Well, chemical peels do that very, very effectively as well. And when you perform a chemical peel with a very superficial agent, what you're doing is you're basically getting a nice result, not an amazing result, but a nice result, but you expect to do it several times. Light chemical peels or superficial chemical peels, you're gonna be doing them several times. So what happens is, like back when I was a fellow, I had a clinic, say on a Thursday afternoon, when all the nurses in the hospital, etc., would come and literally like clockwork, every 6 weeks or so would get their superficial chemical peel. I would have my cotton balls with the chemical peel agent, and literally just as they're sitting there, put it all over, wipe it on, let it sit for however many minutes afterwards, and then they're done. And they would move on. So it was a very quick type of thing. There's no downtime associated with it. Maybe a little bit of redness, a little tiny bit of peeling, especially if you're doing it regularly. You're not gonna be peeling all that much all the time, but you're more or less using it for exfoliation and pigment control. And again, depending on the combination of acids you use, it affects things a little bit differently. That category is great for kind of like someone who has no downtime, is willing to take the slow, steady approach and just improve. Now, the other thing is just know, when you're taking that approach, you really ought to combine that with sun protection, and this is true for any of these things, and then after and during, continue on with really good active skincare so that the effects of the peel are being activated together. You're getting more out of just depending on a chemical peel from time to time. Let's say you're in a hurry and you really want to jumpstart your skin. You've got a lot of brown discoloration, you got a lot of dullness, maybe some fine lines, and you really want to kind of like go for it. And you are willing to take some downtime with it. So what you do is you perform a medium depth chemical peel. A medium depth chemical, the most common ones are the TCA peels. Probably the most popular combination is the Jesner's first TCA next combination. And what happens there is you're getting to the upper portion of the dermis a little bit deeper than you are with the superficial peels, which are mostly just epidermal. You're getting a little bit deeper, but not quite so deep that you're even coming close to scarring. But here's the deal. These peels have the absolute total potential to ruin your skin, meaning that there's an art to this. There is an experience involved. And why that is because there's this term, this concept called reading the peel. Unlike a laser where you literally set it at a certain depth and you run the laser over and it just removes the surface of the skin to that depth, it's very precise. With a chemical peel, you are watching the skin go through a frosting phenomenon. The frosting is basically the chemicals interaction with the surface proteins and the surface components of the skin forming this basic byproduct. So for example, you know how if you ever had a wound, you put hydrogen peroxide in it, it fuzzes and gives you that kind of fuzziness to it. That's a reaction that's forming. What happens with the chemical peels are, it's forming a reaction with the skin. And what you're doing as a practitioner, and this probably is too much information because you're probably not gonna be the one doing the peel. I just want you to understand how important expertise is in the peel before you jump out and go get one. Is when you're doing a medium depth, the person who's performing it has to understand that the first pass of the peel is going to create a certain level of reaction. You need to step back and watch it for a minute or two or three. Let the full extent of the reaction occur. Then where there's areas where it's not quite evenly frosted, you go back and put a little bit more. Or if you want a deeper frost, meaning you realize that you're not deep enough, you want to go a little deeper, you go. So you're playing with it. There's some artistry involved in this. And there's an experience involved because if you go too deep, like you get overzealous and you go too deep, you know how we said we want to stay in that upper portion of the dermis, that upper part of the skin? Well, you could end up going too deep. And if you go too deep, you cause potential scarring, especially in areas like the jawline and things like that where the skin gets a little bit thinner as it transitions into the neck. So bottom line is you gotta be very, very careful with the medium depth chemical peels. The superficial or the light chemical peels, really no harm involved. Caveat to this peel is if you have anything even resembling pigment in your skin, like if you're kind of like somebody who tans relatively easily when you go out in the sun and you're not the person that the second you see the sun, the only thing you'll ever get is like burnt or red, but if you can tan, you usually have a condition in your skin which would lead to potentially having post-inflammatory hyperpigmentation, which means that you might get patches of dark pigment on your skin after a chemical peel, which would be a huge bummer. So if you have that kind of darker skin type or have the potential for tanning, you want to pre-treat your skin with usually a combination or at least one of hydroquinone 4%. You use that for usually 6 to 8 weeks ahead of your peel, or a combination of hydroquinone plus a retin-A or retinol. What that is doing is it's suppressing the production of melanin and pigment so that afterwards, even though your skin is going through inflammation, you're not pumping out a bunch of pigment and therefore you're not forming hyperpigmentation. So medium depth chemical peels are a fantastic, fantastic way. 7 to 10 day downtime. You're gonna go through the aquaphor, you're gonna go through the healing stages. It's gonna look crazy, it's gonna be brown, then it's gonna start to peel in sheets. You're gonna look like a snake, it's gonna go through that. But what comes of it is magic. It's like this beautifully brightened looking skin, and all within that 10-day period. So it's a very, very good approach for more or less instant gratification, although you have to pay that 1 to 2 week price for it. So this is by far the most powerful balance between efficacy and efficiency, time-wise. Probably the most common type of peel done by surgeons or people who really want to kind of like, combine downtime for people or whatever. Now we're gonna go to even higher level of peel, which is quite frankly not done very much anymore. And that is because of some potential side effects that can come from it. But the category of peel is called a deep chemical peel, and that is usually used with phenol. Phenol is another type of chemical, but it penetrates much deeper into the skin. So if somebody has those deep lines, the heavy, coarse lines on their face, etc., historically, those patients would be the ones who would get the deeper peels. Now this one, you're really going through something to get to the other side. But the good news is that the results do work. It's just that nowadays, very few people are interested in going heavy duty deep, as well as the fact that many of those deep kind of lines and wrinkles are really, frankly, caused by laxity and kind of like, bunching of skin. So the skin's got to be lifted anyway. So the deep chemical peel is really not that necessary to even attempt. You have to use an IV, you have to get hydration, you have to be on a heart monitor because the phenol can have some cardiotoxicity. You have to be a lot more aware of it, and again, be in the hands of somebody who's super expert. You use a very, very hardcore occlusive, oftentimes like a tape type of an occlusive that's just like really blocking the skin from drying out. I mean, it's a much bigger to-do, and honestly, I don't even know anyone who does that these days, so I don't want to spend too much time talking about it. It is a bit of a lost art, but it's probably, one we're okay with losing because it's not the workhorse. It's not the place where you really want to be. So bottom line is, chemical peels, don't shy away from it, even though they're not like, as technologically exciting as some of the lasers and things like that out there, but they really do work. They are really, really, generally speaking, the balance between cost as well as efficacy. They strike a beautiful balance. They're oftentimes a lot less expensive, and they don't require a piece of equipment. They do require a very knowledgeable and experienced person doing them for you to be able to do them safely. And as long as your expectations are in the right place, you're going to be happy with the results you get. I mean, my peel patients were very, very happy back when I was doing them much more frequently. So that is chemical peels in a nutshell. I hope that gave you some perspective, both historic as well as my own experiences with it. I give it a big thumbs up. I think it's a treatment that probably should be performed more commonly. But part of the things with these medium peels is people don't have the downtime. It's like hard to take time to recover. So everything has been moving towards less and less downtime. So I think probably the more practical approach is use the light peels in combination with good skincare, and that would probably be a good compromise all around. So when it comes to this type of stuff, like everything else, knowledge is power. You are in control. You become your best advocate. Look for, well-trained people who are doing high volumes of these type of procedures and have, plenty of before and afters to share with you and show you. And again, be careful not to overdo any of these things. Kind of a slow, steady approach is generally speaking the safest and the most efficacious. Be very aware that, like everything else that I talk about when it comes to skincare and skincare lifestyle, consistency and combining with good sun protection is the key. Folks, I hope you enjoyed this. I hope this gave you some information that you can use. Any questions or comments below, drop them below. I love to answer as many of them as I possibly can. And if you enjoyed this, hit like, and if you haven't already, make sure you subscribe to this channel. And if you like content like this, subscribe to our Karam MD Journal, which is a newsletter that I write. It comes to your email inbox once a week. All right, folks, pleasure sharing with you guys. Until next time, Dr. Amir Karam.